Hello, everyone. Good afternoon to everyone, to the new members. I have a very special guest, Bianca. She is one of our new aesthetic nurses, so she has joined us. And I want to go ahead and take this opportunity to discuss with you another aspect of what we're offering. And I want to go ahead and start off by saying it is as organic can get. It is your own natural product, which is the platelet-rich plasma and the PRP and the PRF. I want you to, each one of you, kind of do your research on this. And we're going to hear about each one of these services that we're offering. Hair restoration as well. And again, this is using your own platelet-rich plasma and the rich fibrin that is used to stimulate hair growth, or basically be it facial rejuvenation on the face. I plan on doing this on a scar revision, a patient that I took care of last week. I did excise his nice chin scar that he had, a stellate, irregular scar on the chin, a young gentleman. And so I'm going to go ahead and inject that on the face for enhancement of the scars. We have seen from some of our patients, BII patients, breast implant illness patients who had previous scars around the nipple that were very unsightly because of the previous surgery that they have had, where they sought PRP injections. In this case, I would recommend PRF. And we're going to hear about that from Bianca, so that you certainly enhance and add overall to your quality of skin and scar management and improvement from what is the previous insult that you may have had. So patients who have had hair loss, these are very proven modalities as far as being able to offer symptomatic relief, and certainly hair stimulation, we'll hear about that. PRP with microneedling, PRF injections and scars, or be it on the face or under the eyes, or on the chin, or be it any part of the body, so that it will help enhance the function. And again, using your own tissue. So Bianca, if you can go ahead and talk about each one of them, it's a pleasure and a warm welcome to you to our practice.
So we're most excited to be offering the PRF for hair restoration, and with that, all the different things that we can do with it. The best part about the procedure, the tubes are all natural, so it's just your blood that we're injecting into your skin or hair to help grow. Now, not only is it going to help with thinning, it's going to help that hair grow a little bit faster. So if there's any patchy areas where you're looking for more hair volume, this is going to be the latest and greatest as far as PRF and blood is done to give you that growth factor.
Now, if you can please follow us through, so for example, PRF for ladies that have had alopecia or hair loss, and you want to stimulate the hair growth, or be it a scar that someone has that I've revised, and you can inject PRF. Now, tell us more about what is PRF.
So PRF is going to be our platelet-rich fibrin. Now, again, this is using a centrifuge. We're spinning our blood down, and we're taking the growth factor out of your blood and re-injecting that into the tissue. This is going to help with your body's own natural production, and it's kind of speeding it up a little bit to give you a better quality growth. So it's using all your fibrin, elastin, all the good powerhouses of the blood, and we're re-injecting that into an area where you're having maybe loss of volume, or for instance, having a patchy kind of balding area, or any thinning hair.
So this is where the patients do come in. Now, it may be in the operating room, for example, if the patient is asleep, because that's a very good time. So we basically go into the vein and draw blood, just like when you would get any blood work done at the doctor's office. In this case, we take a couple tubes of that blood, and then we centrifuge it, and we spin down the red blood cells and then the platelets and the white blood cells into the respective different sediments, and then we extract the platelets. This is where the platelets, your own body's platelets, are then taken. And then please go ahead and what do we do exactly with what are the different ways we can what we can do with that?
So for starters, which we're most excited about is for hair. So this is just going to be re-injected into your scalp, minimal bit pain. You might feel a little bit of a poke, and what we're going to have you do is come back for 3 treatments spaced out between 4 and 6 weeks apart. this is gonna give you maximum growth in those areas. So it's imperative that you do those 3 treatments. What we can also do with PRF is heating it down and turning it into more of a gel-like substance. Again, still all natural, we're not adding anything to it. And then we can re-inject that into the face anywhere that you're having loss of volume. This is gonna help with elastin, collagen production, and start to get rid of that lax or crepey skin that we get in the under eye area. Again, depending on your starting point, we might need 2 treatments, we might need 3, but that's something that we can evaluate when you come in and we take a look at you.
So what I would recommend is for the patients to go up and look PRP, which we know as patients would get this on the face, which is what is called the vampire facelift, if you will. But we have PRF, which is much more potent, much more effective 10 times. And it's your own organic natural product, your own body's tissues, which has the growth factors, like Bianca was saying, that really stimulate and enhance and rejuvenate the skin and helps with the scarring as well. And so PRF is the new standard. As you're going to see, this is not an artificial filler. I am not for fillers. This is my practice. And so I'm not a big fan of fillers at all. I have not injected a single filler in my entire practice. And I feel that PRF is what is going to be the future, and this is what we're going to be able to offer the many patients. So also, as you will read, fat grafting to areas where the patient already has a scar from before, not on the breast. So let me go ahead and mention this very carefully. I'm not a big fan of fat grafting to the breast area, because what happens is if you inject 150 or so cc's plus minus to the breast, some of it will be good precious volume to the breast area, but some of it, the fat will inevitably die and may form clumps of dead fat nodules. And now you may pick up on these irregularities, sometimes pins and needle sensation. And now when you get your next mammogram or you do your self-monthly breast exam, that might throw you off. Is this breast cancer? Is this fat necrosis? And altered sensation. So fat grafting to the breast is a big no in my practice, but fat grafting to an old scar or to the face, eventually I will be offering that. It truly does help rejuvenate the face or whatever part of the body where the scar is, and truly does enhance the aesthetic final results. Now, please tell us more about the PRP microneedling.
So starting with the basics, microneedling is a great way to improve fine lines, texture in the skin. It can also help with hyperpigmentation in the skin. And how we can enhance that treatment is by adding PRP. So again, we're drawing your blood, it's all you, and we're going to apply that surface level and microneedle that into the skin. So if you're somebody who suffers from any kind of box scars or acne scarring, adding PRP to your microneedling treatment enhances that treatment by 1,000. So if I had to traditionally do, say, 6 microneedling treatments to kind of fade some scarring, adding PRP, because of that growth factor in there, you're going to cut down the amount of times you're going to have to do that treatment. Maybe even only 3 treatments. It's a better quality of product that we're adding to your skin. And again, it's still all natural. It's just you. Microneedling is inducing a micro injury to the skin. So it's forcing your body's natural healing process so that you can regenerate new collagen in tissue.
So very important. Now, there are patients that have asked me, like a patient in clinic on Monday, a couple of days ago, she had like a very abnormal, what would be a palpable nevus, which was concerning. So I was going to go ahead and excise that at the same time and send it off to pathology. Anytime I remove anything, any lesion, any hyperpigmentation, 100% of the time I send it off to pathologists, because we need to know what it is and what it is not. And so I will be offering that to the patient. The other, for example, a patient, she came in, she had a midline surgical scar. And so I'm going to go ahead and revise that. Another patient came in and she wanted her C-section scar revised because it was indenting inward. So these are small procedures that can certainly be done at the same time while you're on the table. And this will certainly be one less thing that you'll have to deal with when you go back home, since you're already on the table, and this will not add time to the surgery. So another patient came in and she had a scar on her face, and looking at her scar, I told her, she was not going to be a candidate given her presentation. So not 100% of whatever you request will be followed through, but this is something so that as I discussed, we can certainly add overall to the case, which is not going to prolong the case much. And so this is very important. Another patient, for example, had like a small lipoma on the side of the chest and another one on the arm. I was able to revise that. Another patient had a hyperpigmented lesion on the side of the face. Again, I was able to revise that. Any old scar from another previous injury, I will certainly be able to offer that to you as well. So one patient even asked if I could do a carpal tunnel at the same time. Now, depending on the situation, I can certainly add that towards the beginning of the case, and that's a 15-minute, 20-minute procedure from start to finish, and that certainly can be added to those ladies who are looking for relief. There are many patients who have not met their deductible or who are paying cash to come to me. For example, a carpal tunnel can be added for a very nominal cost since you're already on the operating room table and basically you're already sedated. I might as well do the procedure. There are other patients that I've operated on that I can operate on under the Wallon technique, for example, carpal tunnel, which is wide awake, local anesthesia, no tourniquet technique with the patient awake, and the patient has no pain whatsoever, and I'm able to do the surgery in a very controlled fashion. So let me give you an example. There was a physician friend of mine, her father-in-law was on Plavix, and her local hand surgeon did not feel comfortable doing the surgery. I was able to, under local anesthesia, no tourniquet technique, wide awake, I was able to do the operation, and the patient did extremely well. So these are patients who have high deductibles or no insurance, and if they do need carpal tunnel relief, you can certainly address this on the phone consultation, and when you do come to me in clinic, I always get an EMG documentation evidence, objective evidence, along with a history and physical exam. And if you're the right candidate and if you want to add overall to the surgeries, we can certainly go ahead and do that. Now tell us more about other services we're offering, like European facial, for example.
So for our clients, I understand that this is a stressful situation. So I've added some European facials. This is going to be a customized approach just to help your skin feel refreshed, clean, and also help you to relax while you're coming to see us. And then while you're in here, please feel free. We're going to have a terrific skincare line coming in. We can go over everything that you can bring home and continue these treatments on your own skin to help feel beautiful, both inside and out.
So in summary, I just want to mention that this is going to be a very organic addition to the practice. Whereas you will see if you have any old scars, any additional surgeries that you may want to discuss, and facial rejuvenation, enhancement of the face, be it BI, old scars, whatever it may be, we can certainly offer that relief that you're looking for if you certainly choose or desire. Please go ahead and do your homework on PRF, platelet-rich fibrin, and then which is much more potent and effective than PRP. PRP, if you will, is kind of old-fashioned. We're doing the PRP with microneedling. And as you will see, PRF is very effective, has a lot of purposes to it. And certainly with hair restoration and skin rejuvenation, a lot to offer. And and this is certainly picking up not only in the US, but across the world. So you will see benefit of this. Now, thank you very much. Thanks, Bianca. Anything else you want to share?
No, I'm excited. If you guys have any questions, you're interested in the treatments, feel free to call. My name is Bianca. I'll be available to go over any information that you need to clarify.
All right. No, thank you very much. Please can ask questions. We will do this every week so that we can show what type of services we're offering, so that you can certainly take advantage of them if you certainly choose to or desire. Thank you.